Well, it's a cost that everyone has to endure. A recent study shows untreated mental illness costs the state of Indiana $4 billion per year. Newsweek's Adam Pinsker has the breakdown of that study.
Private insurers, Medicaid, employers, and the criminal justice system all bear these costs. The study was launched nearly 2 years ago by the Richard Fairbanks School of Public Health. It says underinsured and non-insured Hoosiers suffer the most. It's a staggering figure, $4 billion. That's how much Indiana loses each year on untreated mental health costs.
Keep in mind that we estimated this in 2019, prior to the COVID-19 pandemic, where we know pandemic restrictions also is associated with an increase in mental illness.
Dr. Heather Taylor with the Richard Fairbanks School of Public Health says the study estimates there are 429,000 Hoosiers living in Indiana that have an untreated or undertreated mental illness.
The individual is suffering from their illness, which is not treated appropriately. And so what happens is downstream, we lose their capability of perhaps contributing to the economy, contributing to the workforce, because they are unable to perhaps hold down a job.
On average, untreated mental health issues cost Hoosier families $1,600 a year and $600 per individual.
Some other things we have to think about are criminal justice system costs or cost to homeless shelters because these individuals go on untreated.
Some of the data in the Fairbanks study was used in the creation and passage of Senate Bill 1. Among other things, it builds out the state's 988 crisis line and funds mental health crisis teams that work side by side with law enforcement. But Taylor says the government isn't the only one who can help. She encourages employers to give employees more time off to take care of their mental health.
Sometimes insurance companies do not pay for mental health services or behavioral health services at the same level they might pay for other healthcare services.
Another study by Forbes magazine found Indiana is the 10th worst in the United States for healthcare due to lack of insurance coverage, high costs, and too few providers. We have links to both of these studies on our website, wishtv.com. Adam Pinsker, WishTV, wishtv.com, and like us on Facebook.